Hey, Dr. Osborne here, and I am in the Gluten-Free Society Research and Newsroom, and the question of the day is, can gluten cause a chronic cough? The answer is coming right up. Hey, Dr. Osborne here in the Gluten-Free Society's newsroom and research room, and today I'm going to be talking a little bit about whether or not gluten can cause a chronic cough. This question came in earlier from one of our viewers, so I thought I would take some time to pull some research to show you the connection between gluten and chronic coughs. So here goes. A recent case report published in the journal Thorax actually found that chronic cough, which is one of the most common reasons people present to a respiratory clinic, up to 20% of cases go undiagnosed, meaning that they don't know what actually is causing the chronic cough. Well, these researchers found one of their patients actually had what's called lymphocytic airway inflammation, meaning lymphocytes, a type of immune cell, was infiltrating into the lungs of this particular patient. In this case, it was a person with celiac disease. So what the researchers found is that taking this patient gluten-free actually led to a resolution of that chronic cough. Another research report showed that a young 8-year-old with celiac disease had resolution of her chronic cough going on a gluten-free diet as well. And then we have a study that was published in the journal Digestion. What this study showed, it showed a correlation between gluten consumption and leaky lung. You've all heard of leaky brain, you've probably heard of leaky gut. Very few people are talking about leaky lung, but this research study showed that gluten could actually create or increase the permeability of the lung lining, leading to airway inflammation and airway problems. We've already had a long-standing correlation between gluten or celiac disease and asthma. This is another one. Now, although asthma doesn't necessarily always present as a chronic cough, it oftentimes can. So many people with asthma do have a chronic cough, and we know that gluten sensitivity can actually create asthmatic-like symptoms. We also know that wheat, particularly there's a condition known as baker's asthma. Bakers are working with wheat flours and tossing these flours up. They're aerosolized, they're breathing them in. It can contribute to asthmatic-like symptoms, both because of the wheat, which has gluten in it, or because of a wheat allergy. But there's also research that shows that the mold in some of these flours, mold contamination can occur in some of these flours, also creating a chronic cough. So the bottom line is, does gluten correlate, or can gluten actually cause a chronic cough? Look, a lot of research is pointing in that direction. There haven't been any major studies that show a black and white correlation, but I would suggest to you, if you're one of those 20% of individuals who have a chronic cough, you've been to a pulmonologist, you've been to a GP, you've been to specialists, and they don't know why you have your cough, look, consider gluten as a potential possibility. I'm going to put a link below this video to a quiz, a simple quiz you can take to determine whether or not gluten-free diet might be the right move for you to make. Also, I'd like to share my own personal story. I'm gluten sensitive myself. I struggled with a chronic cough at night for years. I would lie in bed before going to sleep, and I would cough every night for several minutes before I could finally settle. When I quit eating gluten myself, my chronic cough completely went away. And although that's an anecdotal report for you, it's just one more anecdotal report in a pile of anecdotes and case studies in the research that do confirm that going gluten-free can resolve a chronic cough. So I hope that's helpful for you. If you struggle with a chronic cough, again, take the quiz below. This is Dr. Osborne wishing you an excellent day.